are a variety of things that you can go to the hospital for, and one reason can be for your mental health.
UnityPoint Health St. Luke's inpatient behavioral health unit helps those facing those challenges. KTIV's Taylor Decker takes us through the unit, offering a safe space for healing.
Within the walls of UnityPoint Health is a busy floor, the inpatient behavioral health unit.
It can be anywhere from a mental health or substance abuse court committal, suicidal ideation, delusion, schizophrenia. We see a lot of people who are unmedicated or not maybe on the right medication or have had some medication changes and they're not responding well.
For intake, it starts with an assessment at a mental health care facility or in the emergency room to determine if emergency behavioral health care is needed.
We have a mental health therapist on the unit that they meet with every day, and they also get to participate in inpatient groups 4 times a day and meet with a psychiatrist daily to go through their medications that are started while they are here or restarted if they were on them outside of the hospital.
Here at UnityPoint Health, there are 14 beds on the unit, and majority of the time, beds are full.
It has been consistently full all year.
Staff say they don't want it to be a rough stay, they want it to be healing. Nurses are always on the floor, available for any help the patients may need.
While you're on a medical floor, it's encouraged to be out of your room and be interacting with others, whether it be puzzles or playing card games or other activities.
This unit plays a vital role in serving the ongoing mental health crisis in Siouxland.
People don't feel like they're understood in their mental health as much in the community. They feel safe here, and I am happy that they feel safe here.
For Healthbeat 4, Taylor Decker, KTIV News 4.
A patient can stay as long as they need to feel safe. Sometimes that's days, sometimes it's weeks. When a patient feels safe returning home with support they've connected with, they'll create a discharge plan.
Now, after discharge, patients can utilize the New Beginnings program, which is the outpatient mental health program, and it's a space where people are able to connect with one another. Groups are offered every hour starting at 9 a.m. on Monday, Tuesdays, Thursdays, and Fridays. Goodman adds that it helps people for those who don't really feel like they can connect with people outside of the hospitals. Learn more about this program inside this story on KTIV.com.